Go ahead, ma'am.
Good evening, everyone. So, I welcome you to another session of fertility topics, and this is organized by Oasis Fertility. My name is Dr. Sneha Balki. I am IVF consultant at Oasis Fertility Pune branch. So, today we'll be discussing one of the easy topics whenever we are facing fertility issues, then the couple comes and asks us like what would be the treatment ahead. So treatment part is something that is taken care of by the doctors. So we are there to treat you, we are there to support you, we are there to get you there in your fertility journey. But in return, a doctor expects some things from you too. So there are a few things that we expect the patient to cooperate with us so as to get an optimum result in your fertility journey. So, whenever there is an issue or there is a difficulty in conceiving, then there are a few things that must be done. So, whenever there is a problem, we approach it from the four directions. So, first and foremost direction, of course, obviously, there are your doctors who will help you, who will guide you throughout your fertility treatments. This is the treatment part. Now, apart from treatment, there are few other things like medications. So, medications is also one thing that the doctors are there to help you with. Apart from this, definitely there are few other factors which come into play whenever there is an issue with conceiving. So, what are those factors? Now, these two factors are basically these are falling on your end, and the patient, as a responsible patient, we expect the patient to follow a certain steps. Like, what are the things you can improvise, you can change, you can modify so as to get an optimum result whenever you are going through your fertility treatments. So, we will discuss five such factors which I would expect the patient or the couple to change in their lifestyle and to supplement the fertility treatments. So, these five things we will go step by step and discuss what changes, what healthy options we can choose in order to boost your fertility or enhance your fertility. So, the first thing is, of course, nowadays whatever our lifestyle is quite stressful. We are exposed to so many toxins which affect directly or indirectly. So the first and most important topic for today's discussion, the first most important factor which alters your fertility is your diet. So our Facebook live session before this was mainly concerning about your diet. So the diet, whatever we eat has a lot of effect, a lot of the prospects are seen when we change our diet, and the effects are seen very early, as in a month or so. So, what are the changes that you can do in your diet? So, nowadays we see that because of our lifestyle, because of our busy daily routines and schedules, it's very difficult to have healthier food options. So, whatever options you have, in those options itself, we switch to a much better or healthier options in the same categories. Like whenever you see that you are craving some sweets, you make a healthier choice, make a healthier option, and opt for less refined sugars, less processed food, less of your junk foods, less of oily or fried stuff, less things which come out of a can or out of packets. So all these packaged food material, if we try and avoid, then it's definitely going to boost your fertility. Apart from these, there are some superfoods. What we call as superfoods is diet which is rich in your micronutrients like vitamins, minerals, and antioxidants. So these essentially are required in your fertility cycles, and they are the micronutrients. So they are required in minute quantities, but even these minute quantities are not available in our routine diet. So small changes like including some berries, dry fruits, nuts, and seeds in your day to day diet is going to give you many folds of benefit. So, to include more of fresh fruits, green leafy vegetables in your diet, try to go for local foods. So local foods which grow in your area, they don't have to travel far to reach you, are the foods which are going to be fresher. They'll be more rich in your vitamins and minerals and antioxidant supply. The more distance the food travels to reach you, the more it has faced some preservative exposure, which is going to indirectly affect us. So, this is one thing. There should be at least 5 helpings of fresh fruits and vegetables in our daily intake. So, this is first and foremost. Of course, there are lot many things to be discussed in the diet, which already we have discussed in our previous live sessions. So, this to cover in short, diet is first and foremost important factor, which enables us to achieve a smoother or healthier pregnancy outcome and a fertility journey. So next comes to follow our sleep schedule. So basically, how does a proper sleep affect your fertility? When we follow a proper circadian rhythm or the diurnal variations like day and night, of course it doesn't impact us directly, but it does have some indirect effects on us too. So, how does the outside variations affect your body? So, there is a hormone known as melatonin, which is secreted from your brain, and this hormone is going to impact your pituitary hormones, which are basically the hormones which are required for your follicle growth, for your sperm growth also. So these hormones are secreted, and the boost for that is melatonin. Now melatonin is something that regulates your sleep cycle or your awake and asleep cycles. So this routine gets disturbed when we tend to fall into a bad sleep hygiene or a bad sleep schedule. So what happens is your melatonin secretion is at its peak during 11 p.m. to 2 to 3 a.m. Now, if during these 3 to 4 hours you are awake more often, then this melatonin secretion decreases, which negatively affects your gonadotrophin secretions also. And thus, this cycle, this diurnal cycle, if it's disrupted, it disrupts your monthly cycles also. However, in this regard, of course, it becomes difficult for us to change these schedules because there are many couples in which either the husband or the wife, some or the other person definitely has night duties, or they have to be awake because they might be working for an overseas company. So they have to be awake during that schedule. So, how can we manage this? In order to manage a better sleep schedule, try to find a balance somewhere between your shifts and try to maintain at least that 11 to 2, 11 to 3, which is a very crucial time, that we get at least some amount of sleep in that time. Apart from that, try to follow a routine, at least your own schedule you have to form, in which your daily sleep and awake times are at least planned or at least routinely followed, even if it's not possible to follow what a traditional sleep time would be. So this is also another important thing that nowadays is definitely affecting the fertility negatively. So we'll come to the third factor now. So, in today's age and today's era of socializing, there hardly is any social gathering that occurs without exposure to alcohol, exposure to smoking. Also, there are some, although not as rampant, but definitely in some metropolitan cities, there is also an exposure of addictive substances also. So these things are toxic to your entire physiology, your entire body, definitely, but more so for your gametes. So there is no safety limit. Like if a person asks us that, doctor, what is the amount that maybe I can consume without it affecting my fertility? So to be honest, there is per se no safety limit, or there is no minimal threshold that okay, beyond this if you go, it's going to affect your gametes. So there is for some people, they might be binge drinking uh, sometimes. Some might be taking alcohol daily, some might not be taking at all, they might be taking just once or twice during their 1 month or so. So the frequency doesn't matter. What matters is the least possible volume of alcohol or smoking, whether it's active or passive smoking. It does negatively affect your gametes, not just in their quantity but also their quality. So the quality and quantity of your gametes is going to decline even if you take a little bit of exposure to these addictive substances and harmful and toxic substances. So, whenever faced with a fertility issue or difficulty in conceiving, we advise that you completely avoid intake of alcohol, smoking, and whatever other addictive substances you might be exposed to, because there is no low level or no threshold, and per se no doctor is going to advise you that you continue taking those harmful substances. So this is the third. Then, fourth and very often neglected by people is stress. So, the stress that we face nowadays is definitely at an all time high. This is our age group. Many times, what happens is the people who face issues in conceiving are the younger age group of 25 to 40. So this is your time when you're faced with lots of stress. You do have financial stress. You have your own marriage. You have to settle. You have parents who are aging, who are going through health issues, some diseases and all. And to top it all, you do have challenges with your fertility also. So this all together contributes to disruption of your hormones, and when these hormones get disrupted, the effect is much more than what is anticipated. Physically, we do feel that we are managing the stress pretty well, but it does have much more impact on your physiology and more so on your gamete physiology. So, handling the stress is something that very often it's said, but it's very altogether a different ballgame when it comes to managing the stress per se. So it's easier said than done, but there are many ways which can be tried. The factors which are contributing to the stress not necessarily can be changed, but if it's possible, then definitely we need to work on things one by one and try to tackle our stress causing factors. Apart from that, there are many things which are beyond our control and we cannot manage those. So, those factors, like the things which are not in your control, how to manage the stress because caused because of it. So, include an act of meditation or relaxing exercises like yoga in your routine. So, some amount of exercise is definitely advised, and in this, your pranayam or breathing exercises or yoga or some meditation, whatever suits you best, whatever you can fit in your daily schedule, which effectively you can do at least 4 or 5 days in a week. So this is going to calm you down. It gives you a clearer thought process. It reduces your adrenaline levels. And in this situation, what happens is you boost your own happy hormones, which in turn affect your cycle schedules, your gonadotropins, and effectively resets your reproductive balance. So this is also equally important, and it's often overlooked because we feel rest of the things we are doing, but once you start taking stress of not conceiving, it continues to build up, and there is way the scientists or the physicians or the doctors know that how stress exactly affects your body. So apart from your routine risk like cardiovascular and hypertension and diabetes, it does has a significant effect on your fertility also. The fifth factor, which I personally have seen in many couples who attend the fertility OPDs, who come to us for conceiving, who come consult with us, and whenever we are consulting, because we have seen so many couples, we do acknowledge, we tend to sense it that there is some ongoing tension between the couple also. So, whenever there are strained interpersonal relationships between the husband and wife, it does negatively affect your fertility, because stress is one thing that's affecting you. plus the guilt of not getting a child, which is an birthright of every couple, is what I feel. And when you're unable to do so naturally, when you see that in society your friends or your colleagues or your cousins have conceived naturally, they have a healthy child, but unfortunately, even if you do have accomplishments on the other branches or other fields, this particular thing, when it's stretched too long, it tends to build up that tension between the couple. So, how to deal with this? You have to keep in mind that once the husband and wife, they have to work as a unit, and instead of blaming each other or just putting blames on each other and fighting off about it, rather than that, you both work as a unit. Whenever we see couples whose test results we are reviewing or we are consulting about the test results, and we find that the issue might be between in the wife or it might be in the husband, the other partner goes in a stance where probably that person is accusing the other spouse of him or her being the reason for not being able to conceive, and the other person in which the test results are not normal, that person starts feeling guilty about it. So rather than doing this work as a unit, work as a team, and whatever happens, it's your body. There are not many things in your hands. Even if you follow the other things pretty well, it might still have some shortcomings. So there's nothing to be ashamed of. Nowadays there are so many technologies. The advancements in medical field are too far, and have a proper consultation, and they'll definitely guide you. But one thing you definitely have to remember, that there's no point in bringing a child in this world if you husband and wife are not in a good relation. So try and maintain a good relation with your husband. Do a sport activity or an exercise activity together, if because it's going to have twin benefits. It's going to help you in reconnecting with your spouse, and it boosts your exercise and fertility also. Another thing that you can do is you can go for your outings. It reduces your stress significantly and helps in building up your bond too, which might be strained because of the struggles in conceiving also. So these things are what I would like to conclude, the five main or major factors which you can do on your part to improve your own fertility, along with other treatments or medications which we can take care of. So I conclude this live session today, and I would like to invite any questions if there are any from the audiences. So we have a question like, what decreases fertility? So decline in fertility, there are a few main factors which contribute to a decline in fertility. So first is the advancing age. So as our age advances, our fertility tends to decline. Now this is more pronounced when it comes to females or women. So after a particular age of 35 or 30, nowadays we are encountering decline in fertility at the age of 30 also, which probably 10 years back was encountered at the age of 35 plus. So nowadays advancing age is the most important factor which contributes to decline in fertility. Another thing, nowadays we are seeing younger girls also who have a lesser ovarian reserve, because there is premature or early menarche. It's starting now, and that's leading to rapid depletion of the fertility potential, which is occurring at a younger age because she starts menstruating also earlier. Apart from this, the toxic substances that we are exposed to, the environment, the changing environment, which is quite full of pollution now. Now, there are very limited things that we can do regarding that. But as discussed, to cut down on your alcohol or smoking intake, to cut down on your carbohydrate rich food, fried and processed food intake, or high preservative intake, So all these things are definitely factors which lead to decrease in the fertility, and if we avoid those things, we can definitely at least maintain the fertility potential. So another question is that what are the things that can treat infertility? So in order to treat infertility, it's very important to see the profile of every couple. Every couple is different. So at Oasis Fertility, we have tailored or of the subjective treatments for every couple. So it differs. It all depends on taking into consideration the age of the husband and wife, the duration of infertility, like how long they have been trying to achieve a pregnancy, and what all findings come when we investigate them. Like there are a few blood tests, few sonographies, semen analysis, and all these things we take into consideration. And with that couple particularly in mind, we form a plan of action that is specifically fit for that particular couple. So there are many modalities in which we can treat infertility, from basic treatments like a follicular monitoring to advising the couple when to have relations so that they enhance their own natural fertility, and then simpler treatments like IUI, in which we help the natural process itself, and there's an increased boost of maybe 15 to 20% in conception, to advanced treatments like IVF. So every treatment has its pros and cons, and it's important to give the entire idea or entire option to a couple, where the best possible option is selected particularly for that couple when the gynecologist has a discussion with that couple, and accordingly we can set the time limit of conception and choose a plan accordingly. So we'll conclude the session for today. In case of any fertility queries, or if anybody needs a consultation for regarding fertility, they can definitely contact on the helpline number mentioned below, and we can schedule a visit at Oasis Fertility to guide you better. Thank you.